better prevention. Consumer-driven enrollees are much more likely to participate in smoking cessation programs, stress management programs, nutrition programs, exercise programs. And let me just take a minute to explain that consumer-driven healthcare is about more than just benefit design. More and more employers are realizing that if they get consumer engagement rather than just foisting these things on the consumers, they'll get much better results. And they combine it with wellness programs so that people have the tools and the ability to get these kinds of results. Again, McKinsey found that consumers are 25% more likely to engage in healthy behaviors and 30% more likely to get an annual physical. I'm not going to read that quote. United Health Group in 2007 said they're more likely to see a doctor for diabetes, more likely to receive necessary diabetes exams, more likely to have lipid tests, more likely to use ACE inhibitors, on and on and on and on. Consumer-driven enrollees are invested in their own treatment. Costs. United Benefit Advisors found that the costs went up just 2.7% in 2006 compared to 7.2% for all healthcare plans. Deloitte found, again, that the trend for consumer-driven plans is 2.6% as opposed to 7.4% for HMOs and so on and so forth. Cigna found an overall trend of 10.3% in 2005, but less than half of that for its HRA products and minus 1.2% for its HSA products. Again, Cigna found the same thing in 2007. The really interesting results are on the bottom here. Mercer, the per employee cost and trend from 2006 to 2007. HSAs were $5,600 per employee as compared to PPOs that were $7,300. The trend was half. The trend for PPOs was 6.1% year to year, and for HSAs is 3.5%. These slides need to be updated. The Kaiser Family Foundation just put out a survey that found the annual family premium for an HSA was about $9,100. The annual family premium for an HMO was $13,100, a $4,000 difference in premium. Dramatic, dramatic results. Enrollment trends. United Benefit Advisors just put out a new study. 43% more employers offered them in 2008 than 2007. And enrollment has doubled from 6% in 2007 to 11.2% in 2008. America's health insurance plans does an annual census of enrollment, and you can see the trend as well as I can. 1 million in 05, 3.2 million in 06, 4.5 million in 07, 6.1 million in 08, and these are for HSAs only, not other forms of consumer-driven plans. Most people are expecting that the HSA enrollment alone by the end of this year will be somewhere between 8 and 9 million. And then, that's real tedious, that's boring, okay. So this is a revolution happening under our noses. By the time the politicians get done with their punditry and platitudes and expensive proposals, which will be a long time from now, consumer-driven healthcare will have become one of the dominant forms of healthcare financing in America. And that implies a lot of things. I mean, in 2 years, we will have at least 20–25% in market share in these plans. Once we get to that point, that is a tipping point. That means every doctor, every hospital, every MRI center will have to learn how to deal with cash-paying patients. And cash-paying patients can be very demanding. They want to know the price, and they want to know it now, and they want to know, and if you can't deliver it, they're going to get angry at you. And they're going to beat on the counter until until you tell them. These are not third-party payers that are all squishy, soft, and pleasant to deal with. Angry consumers are very difficult to deal with. And this is a good thing, because frankly, there's a lot in our system to be angry about. There's so much inconvenience, unaccountability, inefficiency, and the only remedy for it, frankly, is an angry consumer. All right. So the revolution is growing. And part of what we're seeing is the advent of retail clinics, the Minute Clinic, the Ready Clinics, in the Walmarts and the Targets. Now, not all of these things make medical doctors happy. But the job here is, frankly, is not to make medical doctors happy. The job here is to make consumers, patients happy. And physicians are being challenged, hospitals are being challenged, pharmaceutical companies are being challenged. Everyone in this system is being challenged by empowered consumers, and this is appropriate. So more and more they're going to retail clinics. They tend to go to retail clinics rather than emergency rooms, and this is a very good thing. It's always baffled my mind why emergency rooms, why hospitals expect people to go to their emergency room and don't set up a wellness clinic, an urgent care center next door at lower cost. For some reason, they haven't done it. The growth of concierge medicine and cash-only medical practices has been dramatic. Concierge medicine, let me back up. There's a real problem in America with primary care. Very few physicians are going into primary care. A lot of the older physicians that have been in primary care are so frustrated by third-party payment and the administrative costs that are imposed on their practices that they're retiring early. It's a huge problem. One of the answers to that problem is concierge medicine. Concierge medicine suggests that consumers pay an extra $1,500 a year to be on a reduced list of patients. Typically, instead of 3,500 patients, a concierge physician will have 800 patients. And they're able to spend time with them, and they're able to provide the service. And if they're admitted to the hospital, they're able to go to the hospital with their patient. They're able to answer the phone 24 hours a day. This is the kind of essential medical care, not just a medical service, but medical care that Americans want and demand. And it's actually cost efficient. There are some indications that we save much more than the $1,500 per patient in reduced hospital services, because people are being cared for in the doctor's office now. So that's growing. More and more physicians are going cash only. They're rejecting insurance contracts altogether. They're saying, if you want to file a claim with your insurance company, go right ahead. But I don't need to know about it. I don't even care who your insurance company is. The cost of my office visit is $45. If you'd like to see me, bring your checkbook, bring your credit card, pay me $45, and I will give you a receipt, and you go deal with your insurance company. It's your insurance company. You chose it. I didn't choose it. You deal with them. And that is growing dramatically. Hospitals are abandoning their old practice of billing self-pay patients the highest possible charge. There's a fiction out there that PPOs get a discount on hospital services. They don't. They get a discount on some mythological charge master price that hardly anyone ever pays. Certainly Medicare doesn't pay it. So there's this fictitious charge of $1,500 for a service, and the PPO says, well, we only paid $700, so we saved you $800. Aren't we good? No. If you had gone in and said, I'm prepared to pay cash at the time of service, the hospital would have charged you $800 or less, because they don't have to wait 60 days to get paid. This came up with a friend of mine whose wife went to get an MRI. The billed charge was $903. Her PPO got it down to $450, and she thought she saved the bundle. that MRI provider would have been happy to give it to her for $450 or less for cash at the time of service.